My name is Amanda Thomas. I am in the doctoral program at Arkansas State University. My quality improvement project is about diabetic self-management education with a reduction in hemoglobin A1Cs. Type 2 diabetes has a high risk for diabetic-related complications and poor glycemic control if they choose not to attend a diabetic self-management class. Diabetes is a metabolic disease and a multifactorial disorder characterized by chronic blood sugars or hypoglycemia, resulting from impaired insulin secretions or actions affecting more than 90% of people with type 2 diabetes. Some benefits of attending a diabetic self-management class are that it provides educational support, reductions in hemoglobin A1Cs, reduces healthcare costs, and improves quality of life. In the Quality Improvement Project, PICO represents P for the population, which is patients with type 2 diabetes. I equals interventions, which represents patients with type 2 diabetes who choose to attend a diabetic self-management class. C compares patients with type 2 diabetes who defer from attending a diabetic self-management class. And O represents the outcomes of reductions of hemoglobin A1Cs 3 months after attending a diabetic self-management class. Less than 50% of patients with type 2 diabetes in the USA receive diabetic self-management classes. The transitional framework was used, the AIM model. The transitional framework 5-step correlation to the quality improvement project are as follows. Step 1, reach. The populations for patients with type 2 diabetes will be reached at the endocrinology clinic. They will have an age range of 30 to 75 years of age. The diabetic self-management class is to increase the knowledge of their disease process. Step 2, effectiveness of efficiency is for all individuals with type 2 diabetes who have an initial hemoglobin A1C, then repeated in 3 months. The patients with type 2 diabetes who attend a diabetic self-management class will have their hemoglobin A1C compared to individuals who defer from taking a diabetic self-management class and see if a reduction in hemoglobin A1Cs occurs with individuals who attend a diabetic self-management class. 3, adoption is adopting the idea of telehealth or individual care. Step 4 is implementation. The diabetic self-management class will be provided by a certified diabetic educator at the Diabetic Education Center. The teaching will follow the guidelines of the American Diabetic Association. The final step is maintenance. Each patient with type 2 diabetes should be referred to attend a diabetic self-management class. There must be follow-up and yearly visits to review new techniques, technology, and updated information. Patients with type 2 diabetes who defer from diabetic self-management class have poor glycemic control, diabetic-related complications, higher number of admissions, and lack of information. Some of the barriers include timing of training, work hours, medical status, language barriers, cost, transportation, culture, and ethnic needs. The project correlation descriptive design was chosen for this project because the goal is to analyze data collection from a specific population compared to the relationship between patients with type 2 diabetes who attend a diabetic self-management class program compared to individuals who choose not to attend a diabetic self-management class program to see if there is a correlation with hemoglobin A1C reductions. The convenient sampling of 20 subjects have been selected from an endocrinology clinic with 2 subjects who attended a diabetic self-management class program and 18 subjects who chose not to attend a diabetic self-management class program, and a hemoglobin A1C have been compared between the 2. The importance of referring patients with type 2 diabetes to a diabetic self-management class program is crucial in increasing their knowledge of the disease, promoting a healthy lifestyle, reducing hemoglobin A1Cs, and reducing medical costs. The DMP project analytical methods will prove that taking a diabetic self-management class can make an impact on patients with type 2 diabetes quality of life.